For years, opioids have been a core component of pain management following surgery. However, following the onset of an opioid epidemic, recent conversations have led to an increased awareness of the deleterious effects of opioid prescription. Particularly for patients who are opioid naive, such as younger patients, the prescription of post-operative opioids has been associated with the development of new persistent opioid use, or need for opioids beyond the acute period following surgery. Given the increased awareness of the impact of opioid prescriptions on patient well-being, we sought to assess whether prescription of post-operative opioids in young adults following various urologic procedures was associated with the development of new persistent opioid use, which we define in this study as new opioid use 3 to 9 months after a procedure. Using a large claims database and retrospective analysis, we created cohorts of young adults aged 13 to 21 who underwent one of 6 urologic procedures between 2010 and 2021. The 6 studied procedures included surgical circumcision, hydrocelectomy, inguinal hernia repair, inguinal orchiopexy, hypospadias repair, and pyeloplasty. We then compared patients who were and were not prescribed post-operative opioids and assessed the development of new persistent opioid use. Overall, we found that 0.41% of patients who did not receive post-operative opioids developed new persistent opioid use, whereas 1.69% of patients who received post-operative opioids developed new persistent opioid use. Patients prescribed post-operative opioids had statistically higher odds of developing new persistent opioid use for hypospadias repair, where they were 17 times more likely, inguinal orchiopexy, where they were 3.46 times more likely, inguinal hernia repair, where they were 2.18 times more likely, and circumcision, where they were 4.83 times more likely. Therefore, the use of post-operative opioids after certain urological procedures in adolescents and young adults is associated with a significant risk of developing new persistent opioid use. Our findings are particularly useful for practicing urologists who should exercise caution when developing pain management practices for their patients. Further research is necessary to determine more effective methods for managing post-operative pain.